Hospitalization. Illness and hospitalization are the first crises children must face, especially during the early childhood. Major stresses of hospitalization include separation, loss of control bodily, injury, and pain. Children's reactions to these crises are influenced by their developmental age. Children and parents expressed fears caused by unfamiliar environment. Hospitalization is a threatening, frightening, and painful environment. In hospitalization, child hospitalization is admittance of a child to the hospital as a patient for treatment or observation or investigative purpose. Hospitalization means child hospitalization is a admittance of a child to the hospital as a patient for treatment, observation, or investigative purpose. Hospital environment for sick child. Hospitalization may be emotionally and developmentally damaging to the child. It causes stress due to imbalance between environmental and social demands and child coping abilities. Mainly three factors are related to hospital environment for sick child. First one social factor, second one physical factor, the third one in change in routine. These are the three main factors related to hospital environment. Role of a pediatric nurse in child care. Here we have 10 roles are there. The roles are primary caregiver, coordinator and collaborator, advocate, then health educator, consultant, counselor, case manager, recreationist, social worker, and researcher. The roles are primary caregiver, coordinator and collaborator, advocate, health educator, consultant, counselor, case manager, recreationist, social worker, and researcher. In health education, here we are following 4 C's. The 4 C's are C for confidence, competence, communication, caring, and empathy. Pediatric nurse carries in 3 levels. The 3 levels are primary level, secondary level, and tertiary level. The first level is primary level. In here, maintain child health, help the child achieves his optimal growth and development, and prevent diseases and their complications. In primary level, maintain child health, help the child to achieve proper growth and development, and prevent diseases and their complications. In secondary we need to assess their needs, planning for care, implementing the care, evaluating child conditions, and providing health teaching to the children and their parents. Then the third one is the tertiary level. The nurse should assist children to return to their maximum level of functioning. Role of nurse in care of hospitalized children. Nurse can play a significant role in helping the child and family members to cope up with the stress of hospitalization. In case of infant, after the admission of an infant to the hospital and completion of pediatric history and assessment. First one is the completion of history and assessment. Then the nurse major responsibility to encourage participation of parents in meeting the physical and emotional needs of infant. First one is a history and assessment. Second one is the participation in physical and emotional needs of infant. Then the nurse must make parents participate in administration of medication, performing procedures, and feeding the infant. The nurse make the parents must participate in the administration of medication, performing of the procedures, and feeding the infant. In this way, Okay. The nurse can minimize the separation anxiety and among infants. Also, the parents are prepared for post hospitalization care also. In infant cases, first the nurse should do the history and assessment, then the parents meeting the physical and emotional needs of infant, and the parents participate in the administration of medications, performing procedures and feeding. In toddlers, nursing care of toddlers during hospitalization must focus preserving the toddler's trust in parents, helping the child express anger, and encourage frequent visits of parents so that the child is not deprived of parental love, and any regressive behavior of the toddler should be accepted without any punishment. Preschool children. The effect of separation anxiety are less acute in preschooler than toddlers. They still feel secure in presence of their parents. Roaming in can be practiced so as to allow maximum contact between parents and preschooler. These children may be allowed to express their feelings to play so that trauma of hospitalization is reduced. The child should be encouraged to participate in self care activities. Then, school children. School aged children view hospitalization as punishment. The hospitalization as a punishment in school children. Immobilization is the most difficult aspects of hospitalization for them. Children must be engaged to watch TV, reading books, etc. so they do not feel bored. Hospitalization make them feel like they are losing self-control and independence. Children in this age group have developed a sense of modesty, so it should be considered while giving any sort of physical care to them. Children must be provided privacy during care. They must be encouraged to take activities a part of their treatment and self-care. Children should be allowed to express their fears, anxiety, and doubts. The nurse should help the children to talk about their feelings, and therapeutic communication should be encouraged. In adolescence, the role of nurse when caring for adolescents includes understanding the emotional impact of illness of them. The best one is the understanding their emotional. Then emotionally how they're reacting, that also main point. Helping them to participate in their treatment program and providing the care that they need. Adolescents, when admitted in hospital, enter a world where they are unaware of what will happen to them, which leads to fear and anxiety. That means what will happen to them, and which leads to fear and anxiety. So nurse should routinely communicate with them and provide the needs of information, reassurance, encouragement, and privacy. Towards self-care will help adolescents gain their self-esteem in independence. In main thing in the adolescents, they need privacy. These are the points included. Role of child health nurse in caring for a hospitalized children.